Hello, this video is being brought to you by the Essex Sexual Health Service. This video is part of a series for parents and carers on topics of RSHE, that is, relationships, sex, and health education. This video has been made for parents and carers to explain what sexual health services their child might be able to access and why. If your child is over 16, they can access all sexual health services completely confidentially. These services include information, contraceptives, and sexual health testing for STIs, that is, sexually transmitted infections. Locally, this also includes the EC card, an app your young person can download that gives them access to free condoms from certain distribution points until the age of 25. You may want to let your young person know that these services are available to them, and if they want support in booking a sexual health appointment, you may be able to help. If you want information on the full spectrum of contraceptive options, please visit the NHS or local sexual health website. Not all contraceptives will suit every person, and they all have pros and cons, so your child may want to try different methods to see what works for them. If your child expresses interest in booking a sexual health appointment or in taking contraception, it doesn't necessarily mean that they're sexually active. They may be taking precautions in case they do become active, or just seeking a method for menstrual control. When discussing contraceptive options with your child, it's important they know that if they do choose to become sexually active, even if they are using hormonal contraceptive, barrier methods, such as condoms, are the only effective protection against STIs, and that no contraceptive method is 100% effective against STIs or pregnancy. So this is a factor they must consider before making the important choice to become sexually active. Many STIs have no immediate symptoms, so it's important they're making safe choices and checking in on their health. For more information around STIs and transmission, again, please visit the NHS website or your local sexual health page. If your child wishes to explore these topics for themselves, you might want to direct them to the Asking for a Friend website, a page set up specifically for young people to answer questions around sexual health, their bodies, and relationships. If your child is between 13 and 16, they may be able to access services confidentially, but only if they fulfill certain specifications. Part of these guidelines state that young people under 16 must be encouraged to inform their parents and carers of their attempt to access services, and that aid is only offered if the clinician or nurse deems that the young person cannot be convinced to tell their parent. If your child's informed you that they would like to make an appointment and you feel it's appropriate, you can offer support to your young person by helping them make an appointment or accompanying them to the appointment if they ask you. Any young person engaged in sexual activity under the age of 13 trying to access sexual health services would trigger an automatic involvement from the local Children's Safeguarding Board and Paediatric Services, as it would be considered statutory rape. Thank you for watching. Please do explore the rest of our series on other topics you may wish to discuss as a parent or carer, such as our relationships video, which explores supporting your child with the emotional decision around sexual relationships. For more information about service provision, here are some links to some external reading. Here are some links to some local support services. Thank you.